in our country report, what I would like to do the following. We would like to, oh, by the way, are we recording this? Okay, good. So I would like to do sort of three things in my presentation. One is really purely update of what we've been doing in the Canada team since the beginning of this project in April 2021. And then secondly, what are things that we still need to do? And then third is some of the highlights from the national surveys of unpaid childcare that was just completed last month. Now, this is really preliminary, descriptive, summary data, so sort of no analysis or anything involved in it. And a number of RAs have been working on this, so it's really interesting and exciting. So what have we been doing since the April of 2021? Well, so what we have been doing for the last year and a half or so is that we put together the Care Economies in Context administrative and research team in Canada. We now have a nice large group of people involved in this. In terms of the admin team, we have Sherry and Mustafa working with us. In terms of the research team, we actually have about 9 graduate RAs. I see some of them here today, Julia, Kayla, Alexa, and Daniela. But then there are a few other RAs who are both from Sociology and MPP program as well. We actually did convene we actually convened last year when we first found out that we got the SHIRC Partnership Research Grant. We did a virtual project meeting, launch meeting last August. We wanted to do in person, but because of the COVID restrictions, we couldn't. So we did virtual. It really doesn't compare to what we're doing today, which is so much better, and our discussion is so much more meaningful, I think. And then just for the Canada team, we did convene a hybrid team meeting last October when the Canadian government allowed a little bit of opening for Canadian travelers to have to travel. And then we did over the last year sort of background research on childcare and elder care policies in Canada. Some of those policy think pieces and policy briefs have been uploaded, that's been written by the RAs, have been uploaded onto our website. We've also spent a lot of time last year sort of developing harmonized questionnaires for both quantitative surveys of unpaid caregiving for childcare and elder care. And then we completed and then we completed the national survey of unpaid caregiving, both for childcare and elder care this summer. So we've been pretty busy. In addition to what we've been doing in terms of research and administrative part is that we've been also working to support other country teams to secure external grants. So for example, we've been working with both Sri Lankan and Mongolian teams to sort of submit proposals for the different grant sources. We've been also, Erica and I have been also working with a team of graduate students and other people for proposals with the Statistics Canada for a new proposal on double caregiving through the CIHR. So it's been, we've been doing a lot of grant proposal work as well. We've been reorganizing and updating the website. We're trying to change the looks and configuration of the website, and as well putting more content into it, including the policy briefs and think pieces that the RAs have written. Um, we're also developing communication strategies. We hired Mustafa last month. He is our communications officer. So he will be focusing, working on the communication strategies for the next few years. We've also begun to work with some institutional partners on data collections and policy discussions. And in particular, we've been working closely with the Statistics Canada, but we've been also working with the ILO, with UN Women, and other larger institutional and national policy bodies as well. We started student workshops and training programs. We started this summer. It's been small, partly because there were still COVID restrictions until September. But what we would like to do is to sort of open up these student workshops to not just our RAs at University of Toronto, but to other graduate students and other RAs in different, who are working with different country teams. So the RAs have come up with a lot of ideas for future training workshops, such as how to write policy briefs, how to do mixed method research, how to do interview, all those things. So if you're graduate students and RAs who are working with you and are interested in sort of participating in our workshops and training programs, that would be super. They're very, very welcome. And of course, we've been, since this beginning of this summer, we've been really focused on so organizing this workshop, the conference and workshop. So that's what we have been doing for the last year and a half. We still have a lot of work to do. So here are some of the sort of things that we still need to do. So starting with the more organizational and administrative part, we need to still put together a management and governance team for this project. We said we will do, but we haven't had a chance to do, partly because we haven't had a chance to even meet in person with each other. So we'll need to do that. We'll discuss this maybe this afternoon. We would like to increase our communications with country teams and partners. And I think this is a great start of that, better communications, because I think, again, nothing like in-person meeting. I'm so sorry that people who are not able to join us, I could only participate online because it's been really great to see everybody in person. So I hope you could join us next time. We also will continue to develop website and communication strategies. In terms of the research, as I mentioned, we have ran and completed the survey of the unpaid caregiving for childcare and elder care this summer. It was run by, it was done through Angus Reid. We have now collected the data. We're cleaning, sorting, coding, all these work that Jiwon was talking about yesterday. So this is a rough timeline of what we're trying to do. We need to do data analysis for quantitative surveys. We need to complete interview surveys. By the way, in both of these large quantitative surveys, we added one question at the end of the surveys, asking people if they would be interested in for us to follow up with participating in an interview survey. And surprisingly, a lot of people said, yeah. So we need to get back to them. We need to sort of complete our interview survey questionnaires, and then we'll have to start the interview survey probably toward the end of next month, well, in a couple of months from now, and then running to January, and then we'll not need to analyze the interview survey over the first quarter of next till May next year. We also have, we're still continuing to do background research as issues keep coming up conceptually and methodologically. So we're working on that. As I mentioned earlier, we're waiting to hear from CIHR research on the that we're doing, Erica and I and Statistics Canada and a bunch of other people working on the mental health impacts of the double care in Canada. And we will continue to support other country teams on their grant applications. So hopefully we'll get positive responses from people. So, and then finally, in terms of the partnership and collaboration, we now have a couple of new partners that was not in the original application, specifically Oxfam Canada and Ontario Nonprofit Network. Both Amar and Pamela are here with us in person. So talk with them. They've been really collaborative and supportive of our project. We would like to continue our ongoing data collaboration and harmonizations with Statistics Canada. And we are now in conversation with potential on potential data collaborations with UN Statistical Agency, who are really interested in sort of what we're doing, how we're developing harmonized questionnaires and things like that, because they would also like to develop harmonized questionnaires for their own project. So we've been doing quite a bit of that. And then finally, in terms of the student training and knowledge mobilization, again, we would really very much, we need to really establish more regular workshops and seminars for the students and young scholars. We want to also begin, we started talking about establishing student mobility. University of Toronto has this mobility support where we could send students to each other's countries and receive people from students from other countries. So we want to sort of work some more on that and really begin to establish student mobility. We also would like to continue strengthening our communications and dialogues with the institutional partners and policy actors. And then, of course, connecting with other country teams more. So that's sort of, I know, I just said everything in one breath, right? Because I'm trying to keep to the 20 minutes. Okay, so let me now talk a little bit about the highlights of preliminary summary data from our survey. So we conducted this survey. We only so far have childcare survey summary data because we're still working on the elder care survey data that just came in a couple of weeks ago. So it was conducted by Angus Reid in August during the during the last week of July and the first week of August, 2-week periods. It's based on nationally representative sample of 1,000. And this was online survey, so we couldn't ask a lot of questions, as again, only 60 data points, so we really had to keep it minimum. And but there's some really interesting outcomes. So for example, we found that unlike Korea or Kenya, we asked people who were primary or shared caregivers of a child or children aged 15 or younger. So the age group of our children are much larger than say Korea or Kenya. And what we found was that, like about 60% of women fall into that category, whereas 40% are men. And it seems like there are a lot of men, but I think part of this is that men are answering as a shared caregiver, not necessarily as primary caregiver. Most of the participants have just one child, just one or two children in the house, in our samples, a survey sample. The household with one or two children of 15 years made up something close, a bit over 85% of all the households that we surveyed. When we broke them down to the sort of how many people who are working in the household by age of the children, what we found is that most of the household with children have two people working. So a significant proportion of these dual worker, two adult worker households. So we also check the household, a number of households with children aged 15 and younger in terms of the household income. They seem to be pretty sort of evenly spread out amongst the different. Oh, you can't see the sorry, you can't see that thing from the. I'm trying to move this so that you could see. Oh. Okay, one more push there. Okay, this is better. So if you look into the household, break them down according to the household income, you see they're pretty well spread out, pretty evenly. Household income. Why is it not happening? Okay. So if we look at the, we also looked at the number of people who are currently employed or working by marital status and by gender. What you see is that women participants report that fewer people are currently working in their household than male participants. We ran a chi-squares test and it shows that there's a significant relationships between the two variables. I think it's possible that the proportion of single, divorced, and separated and widowed women in the household with 0 or 1 person working is higher than men. Right, so I think there's a good proportion that probably what's happening is that there are a good proportion of households that are single mother households, and therefore there's no other person adult working. Whereas I think single father household is not as common as sort of female-headed single parent households. And if we look at the participants taking care of others by gender and age. We ask people if you are taking care of somebody older than 16 or years or older, in addition to be taking care of your child, what we see is something like this, that women, female participants report caring for other people more likely to care for other people in comparison to the male participants. And the difference between female participants caring for other people is actually more than twice that of men caring for other people apart from their own children. So when you look at, when we asked for, so what we did ask for was also, do you use paid childcare services? And what we found is about sort of uh, 60%, a little bit over 60% of respondents were in fact not using um, paid childcare services, which surprised us because we thought there would be more people using paid childcare services. What's interesting from our data is that 54% of respondents in Quebec were using paid childcare services, while in BC, only 29% responded. So Ontario also had a very low sort of paid childcare service respondent rate. So it's really regionally different. And we assume that this is because of the policy differences, because Quebec has the universal $10 a day childcare policy that has been in place for many, many years, whereas BC just signed on to this last year through with the federal government, and Ontario just signed on to this program this year. So both BC and Ontario are really slow at this. So reasons for not using the paid childcare service by age of child, what you see is that sort of significant proportion of people are not using because service fees are simply too expensive. That's for particularly for school age children as well as for younger children, and that. But for some households, it's with children, between age of 13 and 15, people said, well, my child don't need, they're old enough to stay at home. So the financial issue is for the paid childcare is critical. We also asked sort of frequency of what kind of childcare services that they were using. What we see is that Quebec is a province where the participants are more likely to use paid childcare services, and both both private and public as well. It's not showing in this graph, but you see by the sort of diversity of paid care services from this. In terms of the sort of use of paid care services by household income, what we found is that the higher income household report more use of paid childcare services. But within each group, most of the participants actually reported not using the childcare services. This is a part where it's kind of might be hard to see, but we really did ask specific questions about how they felt, some of the mental and physical sort of impacts of having childcare. And I just want to, I know I don't have much time left, but just want to highlight a couple of things. So, for example, interestingly, you see that the parts that's highlighted are the significant findings that are significant from our survey. What you see is that women are clearly more distracted during meal. They're more stressed out, they're more exhausted and less satisfied with the division of care with their partners or other significant others. The younger people within younger generation are more distracted during the meal, must conduct multiple tasks and feel more exhausted. We assume this is because they have younger children than older. Again, the regional difference, it's not, it's shown here a little bit, is that compared to BC and Ontario, people in Saskatchewan, Manitoba, and Atlantic provinces feel that they have to conduct more multitask tasks in terms of care. Compared to Saskatchewan and Manitoba, people in Alberta, Ontario, and Quebec feel more stressed at the end of the day. Um, in terms of the income compared to people with less than 50,000 dollar income, so that's really sort of the middle to higher income household people, with more were more satisfied with the division of care work. So it's really the higher income household that feel more satisfied with the division of care. And then let me see, I'm trying to look at some of the um, other significant points. Um, I think that's about it. I'm going to stop here. We have actually a lot of information, and if you have any other questions, or if you want to take a look at the data, once it's done, we will be happy to share. Once it's cleaned and set, we'll be happy to share. Okay, I'll stop here. Thank you.